Hi everybody, Dr. Cary Yurkiw here, and I'm the chiropractor at Tut Street Family Chiropractic in Kelowna. Today I am going over the Spine Flex solution. That's this book that I wrote. It was released on December the 1st, and my plan is to go over the material with you here on social media and on YouTube as the days progress going forward. So I kind of want to get into the chapter material, explain it a little bit with you, answer some of the questions that you might have. So if you're with me here on YouTube, you're going to be able to see the material on the screen. If you're with me on Instagram or social media, you may not be able to see this, but I'll do my best to describe the material in the book with you. So here's the manuscript for the Spine Flex solution. Actually, when you publish a book, what happens is Amazon gives you a downloadable version of it, so you can check it over and make sure there's no spelling errors, it's formatted properly. So this is my downloaded version that I'm going over with you. Here's the chapter titles. I think what I'll do today is go over chapter 1, which is understanding the root cause of back pain. And so I think, people come into the clinic for back pain, and there's a variety of different causes, and that's what makes it a complex issue. But millions of people are affected by it. In fact, it's usually the number one or number two reason that people present to an emergency room is for some type of back pain. And it kind of rivals the common cold as the top reason to go to the emergency room. So it's very prevalent. The research tells us that 4 out of 10 people currently have back pain. About 8 out of 10 have back pain at some point in their lives. So it's very prevalent. And there's a number of different reasons for it. Some of those reasons are emotional or psychological impacts. Stress and tension can manifest itself in the body, of course. And some of those reasons are more physical, like an injury or repetitive strain to the back. And I think it's important to understand the anatomy of the spine. When we talk about this, there's 4 different regions in the spine. And here in this picture, I'm showing you the nervous system with the regions. So one is the cervical region, which is the neck area. This has 7 vertebrae, and it can be injured in like a car accident where you get whiplash, or maybe a repetitive strain. Let's say you're a plumber and you're under the sink and you're twisting your neck and you're looking up. That can injure the neck, of course, too. And sports injuries, we see a lot of that in the clinic where somebody, like a hit in football or hockey, one of those types of injuries. Sometimes even like concussions or headaches can go with injuries in the neck area. And the nerves from the neck travel down the arms. I'm wondering if you can see this okay. The brachial nerves come from the neck, go down the arm, so that can cause a referred pain down the arm as well. The other region, the middle part of the spine, that's called the thoracic spine, the upper back. It has 12 vertebrae, and there's ribs attached onto that part of the spine. So you have 12 ribs, 12 on one side, 12 on the other. There's a couple floating ribs in there. We won't get into that today, maybe on a subsequent video, but the floating ribs are a little bit more flexible, but they're also more prone to injury. And then the lumbar spine, the low back, 5 vertebrae there, numbered from L1 down to L5. A lot of people know about L5 because it's the most commonly misaligned vertebrae in the spine, and that can cause a pinched nerve at L5, which can then result in something like sciatica because the nerves in the low part of the back go down the legs. And then the bottom of the spine, this is the sacrum and coccyx, the tailbone area. Up until when you're 13, the segments in the sacrum are all individual. So you have 4 different vertebrae, but then after 13 years old, those segments fuse together, and then they're just one block of bone that has holes coming out of it where the nerves come out. And that's those sacral nerves that we talked about. Now they're important because from the first three sacral nerves, S1, 2, and 3, that forms the sciatic nerve, and that travels down your leg on the right and the left. So very important that we address any sacral issues, and especially any injuries before 13 years old, because then we're going to get those bones fusing together and then one block of bone with 4 vertebrae encompassing it. So that's very important. Now, common causes of back pain, misalignments of the spine, and in chiropractic we call that a subluxation. So if you have a subluxation, it can cause pain because the bone's out of position, it can pinch the nerve. And here in this picture, you can see where the nerves come out. This is a cross section of the spine. There's the spinal cord looking down at it. And then here's the nerve coming out on the left and the right. And there's the vertebrae with the disc, and then the back of the vertebrae with the bony prominences right there. So sometimes that can pinch a nerve when there's a misalignment or squish the disc, causing a disc bulge. If that's there for a long time, can result in degenerative disc disease or arthritis that can develop, sciatica, which we've already talked about, where there's pain coming from the back down the leg. And then poor posture has an effect on this too. Let's say you're slouching or you're sitting on one side, or sometimes I see men coming in with a wallet in their back pocket and they're sitting on it, it's pushing up on one side of their hip and the other side's down, so there's an imbalance, causing a lot of stress on one side of their back versus the other. Tell them to take the wallet out so that it doesn't stress out the back. And then lifestyle factors too. You know, if you're carrying extra weight, that can pull the spine forward or out of place. If you're losing weight, your spine can shift and start to try to recompensate. If you're pregnant, that can really affect the alignment of the spine. And then after you have the baby, there has to be a quick adaptation. So there's a number of different factors that can affect the health and the alignment, the posture of the spine, and subsequently the nervous system, because it runs through the spinal cord and then out between the bones to different areas of the body. So that's chapter 1, just explaining the different causes of back pain. I'm going to get more into the other chapters, like what we do in the clinic. And we use the Spine Flex solution here in the clinic, which is a method to treat back conditions, to increase flexibility of the spine, to use equipment like shockwave and laser orthotics to help support the chiropractic care. So if you have any questions, please feel free to leave them in the comments or here in the chat. You can also DM me on social media. Be happy to answer those questions for you. We're located in Kelowna, and we are accepting new patients. You don't need a doctor referral. We do bill directly to insurance. So if you'd like to book an appointment, you can go right online to our website, tutstreetfamilychiropractic.com, or you can message us here at the clinic too at 250-486-0062.